So, hello there everyone, myself Dr. Sahil Patel, a consultant homeopath. So, today we are going to discuss about small wounds and lacerations and the role of homeopathic medicines in those conditions. So, we are discussing it from book of Dr. Borland sir. He has written many books as I have discussed already in my previous videos. So, you can refer to those things and those videos for that. So today we are going to discuss about small wounds and lacerations. There are many specific remedies in homeopathy which helps to boost up the healing process for this kind of patients. For small wounds, lacerations or any kind of similar conditions, three commonly indicated remedies are there. And these three remedies work miraculously in every condition. So the first remedy is most commonest, as you can think, is Calendula. Calendula remedy works very good in the mother tincture form, in the potency form, and even the Calendula creams are made, even Calendula ointments, lotions are made, which are really very helpful for the patients where even cosmetic effect of it is to be seen. So the ordinary homeopathic routine of putting a calendula dressing on the wound gives extremely good results. But it also has very good action in the potency form. If a person or the patient comes to you with a lacerated wound or small any kind of bruised wound where a skin layer is teared up, you can give directly the calendula dressing to your patients. If you are doing the dressing, just use calendula mother tincture or just make the material which you are going to use with a calendula mother tincture. Don't directly apply the calendula mother tincture on the wound. Why? Because it is having ethyl alcohol. It can lead to discomfort for the patient. So kindly take care of it. And the next thing is that after doing the dressing thing, the dressing part, you should prescribe calendula 30th or the calendula 200th potency. It really works very well. It helps to make the healing process faster and boosts the bodily metabolism to heal that certain part. Next thing is that a wet calendula lotion or the dressing can be applied on the laceration site, as I have told. Then with a wound involving any sensitive area. Now what is the sensitive area? Where the nerve endings are present. The nerve endings especially present in the nail beds, on the fingers, on the toes, where even if the minor of the injuries leads to great deal of the pain, where particularly shooting pains are there, where just a starting portion is there, no infection or that is present, we have to see that condition where only and only person is having the nerve ending pain or the injury directly to the nerve ending areas. Then dressing of the another remedy, which is Hypericum, can be done for this kind of patients. And Hypericum can also be prescribed to the patients orally in the 30th or the 200th potency. See, in the potencies which are given orally really works very well. There are many physicians who are against the external applications. I am not someone who promotes it or who is disagreeing with it, but we can help our patient. The morally treatment should be done for the patient. If a person is coming with the bruised pain and if you are just saying that I am going to give the oral medications and you are going to treat it like that, the treatment is going to be get better. But the problem is that the person's mentality will be like, this physician is not helping me out, he has not done any kind of dressing. Do you really know patient nowadays having just a minor small wound needs that dressing to just do the show off, right? Why? Because this world is now converted to the psychotic miasm manifestation or somewhat like a tubercular manifestation. They just want to hyper their conditions, they just want to make people gain their attention, right? So to all those psychotics, you have to give the treatment based on the dressing style also. So you should do that. Then the third thing is that after a confinement, when an instrumental interference is done and the damage of the coccyx region below the sacrum at the spinal region with the coccygeal pain, or the patient has fallen down from the bike or any kind of accident has happened due to which directly the lower back pain was there or the coccyx region was affected, there Hypericum remedy can be given to those patients. Hypericum 200 potency works very well for those conditions. and the person will actually remember you for his lifetime, because painkillers were only helping that patient for some duration, but Hypericum was affecting much better in those conditions, because the nerve endings which were affected had a soothing affectation because of the Hypericum oral medication which was given in those cases. Then in the lacerated fingers, you can give patient Hypericum lotion. I'm not talking about any pharmaceutical company. You can actually make from the mother tincture, and you can use all those glycerin or Vaseline can be used as a petroleum jelly to make all those lotions and ointments from your own side for the patient's betterment. Or the Hypericum dressing can be done, as well as Hypericum potency orally can be given to those patients. So Hypericum, where it can be given to the nerve endings, sensitive areas, toes, nails, nail beds, injuries, for the patients having coccygeal pain after effects of falling down on the coccyx region. Then Hypericum dressing can be done. First remedy, which was Calendula, it can also be given to the lacerated or bruised type of conditions where a wound is open on the skin layers. Now let us go to the third remedy. Not only does healing take place, but what happens after effects of these things leads to septic conditions, especially in diabetes patients. The person's injury leads directly to the infections, it leads to the septic conditions. So why Calendula is given? Calendula is given for the mere purpose of that it will enhance the healing process in such a fast way that we can even control the septic condition to get developed. So be quick and fast to act in those conditions. Don't just think that without antibiotics we cannot do anything in those conditions. Do not think that you have to just go for a surgical intervention for those smaller wounds. You can directly prescribe Calendula in those patients. Then the next, Arnica remedy. As we all know, in injuries, Arnica is one of the baseline remedy in many conditions. Then Arnica can be given externally, internally, where the skin is broken and it leads to inflammatory condition. Even if the starting phase of inflammation is there, even the inflammation has settled in, Arnica montana can be given for those patients. But I prefer that Calendula and Hypericum works very good in external applications, but don't give Arnica in those external application conditions, because internally Arnica works very well. Neovascularization happens on that inflammatory side, and the person gets very good result after even giving a single dose of that remedy. Don't go for the fancy potencies for those conditions. Even 30th potency, even 200th potency, a single dose works very well of Arnica for those patients. Then the third remedy, which commonly is indicated in the smaller wounds, is Hemamalis. Hemamalis will reduce the bruising effect, and it is also one of the good and the safe external application in those conditions. Why Hemamalis? Hemamalis has very good affection on the venous system, so you have to justify those conditions. So these were the three remedies most common. I have talked about four remedies, which is Calendula, second one is Hypericum, third one is Arnica montana, and fourth one is Hemamalis, which will reduce the bruising effect of it. So don't get shied away because of the conditions of the small wounds and lacerations. Don't even think that you are on the lower level in treating such cases. You can directly use the dressing material for those patients using Calendula or Hypericum, and even you can also prescribe these remedies in 30th or 200 potency for your patients. So this was the video regarding the small wounds and lacerations from Dr. Borland's book. If you have any kind of doubts, queries, directly do comments in the comment section. I will be glad to teach you and explain you different conditions, different disease conditions, as well as different medicines from our books. I can help you out to distinguish between the rubrics. Any kind of homeopathic video, any kind of allied subject regarding query, I am ready for teaching those conditions. So thank you for staying tuned with my channel, and kindly share this video with your friends.